Hello and welcome back to LTC Heroes Live by Experience Care. My name is Peter Murphy Lewis. I'm your host. I'm excited because I have been looking forward to this interview since I saw it on my agenda. I'd like to talk about workforce. I like to talk about education, and I like to talk about getting young people thinking about healthcare way before they're thinking about their
Mm.
first job. So that's why today I'm talking to Dr. Stacey Ocander. She is in charge of a really cool initiative. It's called the Nebraska Healthcare Talent Pipeline Initiative. Dr. Ocander, welcome to the program.
Thank you for having me. That's a mouthful.
It is, and this is my second take. So the first one I completely butchered it, but that second
We're
one got
all
a little
good.
bit better. Speaking of education, I need to work on that. So let's start off with what is the initiative that you're working on at the high level?
You bet. So it's really a statewide curriculum of exploration into every single healthcare profession that we could possibly think of that kids never think of. So they think of nurses and doctors and working in a hospital and a clinic, but they don't think of recreational therapy or dietetics or informatics or any of those things, or working in long term care, assisted living, and memory care.
How did the initiative come about? Is this something that you all have been thinking about for a year? Has it been something 10 years in the works? And then tell me, does this, and also, did it start in acute? Because you're at a long-term care convention.
Right. Yeah, I always say it started because of Groundhog's Day, and I mean that because we all kept meeting across the state trying to solve this workforce issue, and it was Groundhog's Day, same conversation, same meetings, same people, and we got nowhere. And so when we would realize that there were some great things happening across our state, but people would hit a barrier with, what do I do with it next? Or I don't really know about the curriculum. Or I just call a facility and say, I'm bringing 10 kids over. And the facility says, I don't know what to do with those 10 kids.
Hmm.
And so it really started in saying, healthcare is for everybody at all ages, in all facilities, and all places. And that absolutely has to include long-term care, assisted living, memory care, and the clinics and the hospitals all working together because we share the same workforce.
Hmm. I, this might come off as a stupid question, but why didn't this exist before?
I think it existed in pockets, but it takes a lot of time and energy to get people together and figuring out what do we have across the state that's consistent. We know we have community colleges across the state that all have service areas. We know we have educational service units across the state that have areas. We have long-term care, we have hospitals, we have docs, we have retired healthcare professionals. So bring them together as a healthcare team where they're at,
Hmm.
partnering with their K-12 system and their after school programs, which are across our state. And that's where we hit home.
This is about to launch soon, right? January
Yeah.
2024.
Yeah.
What do you need now? If there's someone who listens to this and says, "This is brilliant. I believe in this initiative. I want to help."
Yeah. What we need are facilities to say when we're running a summer camp, because we know about the after school programs. They're in the schools or they're in a church or they're in a rec center. We know that. We know how to find them. When we have a facility that says to us, "Hey, I would love to host that week-long camp in my facility," that's where it needs to be. We need those kids to see that long-term care, assisted living, all those areas we talked about are great places to be,
Mm.
right? They're wonderful places to work. How do you feel when you're in that space? And hosting a camp there where those students are there, that's what we need. We need people who are saying, "I've retired from healthcare education, but I would love to give back a little bit." We wanna know that you wanna give back and you're willing to be an instructor.
Mm.
You're willing to run a camp for a week. Because again, it's in every our goal is to have this in every community across our state.
How would you define success? Maybe give me what your lofty goal is a year or 3 years from now, and then your bare minimum. Like, I have to get this done. Our system needs it. Our elderly need it.
Mhm. Yeah, our system and our elderly, all of us needed it years ago. And it's really the intersection of bringing education and healthcare together as a partner, really building on industry. We have great industry partners. And how do we capitalize on that? So the wins are starts in third grade.
Hmm.
I wanna see these kids stay with us through the 6th grade program. I wanna see them coming into our summer camps, and I want to see them graduating from at least the community college and going on to our 4-year partners. Having those kids continue in that pipeline, getting that CNA at 16, working in dietary, those are our wins.
Hmm.
Those are our wins, absolutely, and just to have kids talk about all the different things they can be that they never really knew.
What are some of the moving parts that that you've been involved with to do this heavy lift? Like, who are the partners that have been
Mhm.
involved? How many people have been working on this? Who are the people that have backed you?
Right. So the backers, which have been so amazingly generous, Nebraska Hospital Association, Nebraska Healthcare Association, Medica Insurance, and the Nebraska Medical Association pooled their funds together about a year ago to bring me on as the lead curriculum writer and consultant. So I took the heavy lift from there, but it's really meeting with all of those partners to say, now I need your communication department, NHA, to start drafting the book, putting the graphics to work,
Mm,
getting in front of groups like today and speaking with people to say, what can you bring to the table? What can we use that you have? It does none of us any good to go out and buy a ton of equipment when we have it sitting in every one of these facilities and we're going to use crutches for 1 week. Why would we buy them?
mm.
So really capitalizing on those things, the educational facilities bringing together, the community college deans are meeting, the deans from our private and public four-year schools. So just continuing to bring people in the loop that know that it's the time is right and
Mhm.
third grade's not too young.
You've been, uh, living and breathing this and for quite some time. What is the part of this initiative that excites you the most? And I'll add some color to it. So, like, on a Wednesday night when you have friends over for dinner, what do you start talking about when it's not time for you to talk about the initiative, but
Mhm.
you're just exuberant with talking about this program?
Yeah, it's so there's 2 advisory councils for this project. One is, grown people, and the other one is 3rd through 6th graders, and they're brutal, and that's exactly what I talk about. I said I needed an advisory group of kids who are actually going to be doing this, and they've been so helpful. Like, I will give them an activity that we're going to do, and they'll literally look at me and say, "I would never do that. That's so boring. Why would I do that?" Throw it out, right? And get something that they're excited about. Or they'll say to me, "Well, technology does this." No clue technology did that. So now incorporating really real time things that these 3rd through 6th graders have been just a godsend in building the curriculum out that's going to be appropriate for them. That's what excites me.
Is there anything happen nationally that is comparable? Are you able to knock on the door of other resources who've already gone down this path?
No, right now they're not that we have found. There usually starts in 10th or 11th grade, sometimes ninth with career academies, which we've been very successful in our state with dual enrollment and career academies. But then trying to even reach into the middle schools has been a stretch. The only thing that I can compare it to is in my previous role as the Dean of Health at Metropolitan Community College. In 2015, we started a junior fire cadet program for 3rd through 6th graders. And those kids stayed with us, same model through elementary school into a junior explorers program in the summer and on to career academies in the high school. And a lot of them just graduated this May.
Mm,
So to have them with us from 3rd grade on, we know the model works in terms of support, in terms of even thinking about how to navigate college and pay for college,
mm.
and teaching these students empathy and work ethic and all of those. So that's the model we built off of.
I know from going to a lot of conventions, I don't see a lot of experts that come from the acute side that are trying to bridge and make sure that they're also looking out for post-acute. What has been the feedback of some of the members at this innovation summit that hear what you're doing and making sure that their interests are represented as well?
Yeah, the one comment that has been consistent is we have all these great healthcare organizations in our state, from the FQHCs with HCAN to the Nebraska Healthcare Association to Nebraska Medical Association and my current employer, Nebraska Hospital Association. And we're all coming together. Like, we're all solving this problem together. Everybody is on board and seeing how do we continue to support each other. And that is just so exciting because it's all of our problem.
As we wrap up, Dr. Ocander, someone's gonna see this and be like, "I wanna follow up. I wanna participate." How can they reach out? Where can they find you? Where can they get more information?
Right. So they can reach out to me at nebraskahospitals.org, and it's just SOCANDER at nebraskahospitals.org. And I would love their emails. I would love their contact information. I would love them to say, "Hey, talk to our facility," or "We want to host a camp," or "I'm from an after school program," or "I'm retired and really just want to be involved." Please contact me.
Wonderful. Thank you so much for sharing your story, and thanks for the great work you're doing.
Thank you so much for having me.